Thank you. All right, well, we touched on this briefly yesterday for some of you who were here on the same session. I'm going to focus today on the most effective technology. If you guys remember that table that I showed, the combination of HIFEM, which stands for high intensity focused electromagnetic energy, and radio frequency is the most effective treatment or non-invasive device that we currently have for body contouring. So I was trying to keep this kind of without any brand names, but essentially this device is the only on the market at this time. And like I said, it is a combination of these two technologies that are completely different, independent, and in theory should not be able to even be used together, just from the standpoint of how they actually, the devices work. But these people were able to figure this out in a very, very smart way. And right now what we have is a very, very effective treatment that is delivered through the application of these pads essentially placed over the muscle area that we're trying to stimulate or grow or strengthen in sessions that are only 30 minutes long and are essentially very, very comfortable, pretty much painless. It is FDA approved for non-invasive lipolysis and decrease of abdominal circumference, as well as muscle strengthening and increased muscle tone in abdomen, glutes, thighs, arms, essentially any area where you have a muscle, you can use these kinds of devices to achieve strengthening and toning. So essentially you have, we were just talking about radio frequency, which is represented on the left side of your screen with the red, and electromagnetic energy. So essentially for radio frequency to work, essentially if you think about those kinds of loops, and in order for them to be present in the same applicator with an electromagnetic field, it's very complicated to have that. But again, they were able to put these two devices together, and that's what makes it, or these technologies together in this device, and that's what makes it very, very efficient, and I'll explain that to you. So the predecessor to this device was actually only using the high-intensity focused electromagnetic energy only for muscle stimulation, and which is represented on the blue on the right. It did no cryolipolysis, but even just, if you look on the left, when you combine it to radio frequency, your ability to increase that muscle mass and that muscle toning goes up, and your ability to eliminate fat is also increased by the ability of the muscle strengthening, because as you well know, just as the muscle is getting stronger, getting bigger, more muscle fibers are developed, they're going to help use that adipose tissue in the neighboring area as a source of fuel. And normally these treatments require at least a good 4 sessions that last 30 minutes, like I already mentioned, essentially painless, very, very comfortable. And after the final session, we always want to wait at least a good 2 to 3 months to see that final result. It's like going to the gym and you go to the gym for the very last time. It's not like that's where your muscle stops growing. There's actually still stimulus over the next few months. Even if you stop, that muscle is going to continue to grow. So usually we don't say we have final results until 2 or 3 months later after finishing our last session. But essentially this is, let's say, imagine this is your abdomen, your rectus abdominis, and you're going to put this applicator over the abdomen, which is probably the most common area that we use it. The radio frequency, essentially what it's going to generate, just to keep it very simple and not dive into physics too much right now, it's going to heat up the tissues. And so essentially this is all about the differences in conductivity that each of the tissues have. So the adipose tissue actually has the lowest, and so it's going to heat up much, much faster. And that's why the temperature, essentially, you see that even though you're using the same temperature throughout all of the layers of the abdomen, it is the adipose tissue that actually reaches that 43 to 45 degree Celsius temperature that is needed for the lipolysis. Normally, when we're talking about skin tightening or collagen and elastin stimulation, we're talking about lower temperatures, generally 40 to 42. We're not going to do any fat elimination at those temperatures. So it's just the ability to be able to generate those higher temperatures in the exact tissue that we want to get rid of what makes this very efficient. Now, the other benefit, we already looked at this as far as like the temperature going up to 44, 45 degrees. We actually achieve this very quickly within the first 4 to 6 minutes, but this is what's really cool. Obviously, that heat also has an effect on the muscle. And so just like any of you guys who go to the gym, you guys are gonna warm up first because that is going to enhance your ability to function and do those exercises in a very efficient way. It's gonna increase the blood flow. So there's actually a lot of benefit, again, going back to comparing these versus the original device. Now we get this heating that is actually going to prepare the muscle for probably the most, essentially what we call a supramaximal contraction. These are contractions that anyone, not even the highest trained athlete, would ever be able to achieve on their own voluntarily. So this temperature actually prepares the muscle, which is really nice and just sets everything to be able to achieve what we really want in a very efficient way from the very first few minutes. And so essentially with the HIFEM, which is the electromagnetic energy, what we're doing with that energy is we're stimulating the motor neuron, which in turn induce very, very powerful, multiple them, thousands of them, contractions during a treatment to really achieve that in hyperplasia and, oh my gosh, forgot the word, increased number and increased size of the fibers, okay? So hypertrophy and hyperplasia, sorry. So we do it in a very, very efficient way. So in theory, they say that doing a session of HIFEM plus RF in 30 minutes is the equivalent to doing, let's say, 20,000 crunches in 30 minutes. Or like let's say 4-session treatment done weekly is the equivalent to doing 12 to 16 weeks of high-intensity training, interval training. So it's very, very efficient workout that any person can do, even if they're injured, even if they had surgery. So a lot of athletes are actually using this kind of technology to stay in shape, if you want it that way. Let's say somebody, you know, a football player had an injury and they cannot be at the gym, they cannot be exercising, they cannot be playing. This is a way to maintain their muscle because they don't have to move. This type of therapy is actually being used in people who are paralyzed, people who have all sorts of neurologic disorders and neuromuscular disorders where they have significant limitations to movement. This is a way of preventing that muscle degeneration and loss of muscle mass. This is just a short video to show kind of like the two technologies working at the same time. They're synchronized, and what they're doing is heating up all of the tissues very efficiently of the fat to achieve that lipolysis, and then stimulating the heat and the increased blood flow in the muscle to really get that hyperplasia and hypertrophy of the muscle that we're trying to achieve with this combination. So there's multiple studies that support the findings. Multiple studies have been done, which are obviously available as far as looking at results from CT scans, ultrasounds, MRIs, histology studies, all of which show that the abdominal circumference decreases by about 6 centimeters on average. There's an average of 30% of fat loss, 25% increase of the muscle mass, and it's actually been proven that this completely improves that diastasis recti, that separation that happens in females after pregnancy. It actually can help up to 20%. So a very, very efficient and effective treatment that can be done very safely and in a very comfortable and convenient way for the patients. We looked at this table yesterday, again, just comparing with everything else that's available. And I just want to show you kind of our experience. So, since we're talking about aesthetics and practice and all of that, I'll just chime in, just a couple of things about photography. So it is very, very important that if you are going to do this, that you really invest in good photography, making sure that those pictures have, like you were saying, the same lighting, and recognizing that if you don't have the same lighting, then take those BNAs with a grain of salt, right? But try to strive as best as you can to have like a good system. And for me, especially for body contouring, I have a special camera that actually allows me to provide very objective data as far as volume changes, abdominal circumference changes that, for example, if you get a patient who got amazing results, Obviously, these are results that you want to share with the world, but mostly with the patient. You want to keep them motivated. This is proof that this works, and they're going to continue being your patient and continue the maintenance that sometimes you require with some of these treatments. But if, on the other hand, you have someone who didn't see results, because this happens for humans, and it's crazy how people will say that they don't see change. Having good BNAs and an objective way of showing how there has been a change is going to protect you and actually help you actually show that it did work and change a patient from being in a position where they feel they didn't get anything to stimulated and happy and excited to continue. So I'm just going to go quickly over this. This was just 4 sessions of HIFEM plus RF. This patient was extremely happy. You can see there's been definitely 10, 13 centimeters decrease in her circumference throughout, and just very, very happy overall. So you can obviously do more sessions. You can continue. If you have someone who's far from the goals, you can always continue doing more sessions. So she definitely went and did another round, and this is where we got her. Obviously, this is a very, very satisfied patient. Another one, very clear improvement. We have the ability to superimpose the images to show a phantom image of where they were before. Obviously, this is a very satisfied patient as well. The other thing is that it's not only what they get from the aesthetic standpoint and improvement, they actually, just having a stronger abdominal wall gives you better posture, and it actually helps with back pain. This is what we see with these patients. They feel stronger. This definitely goes beyond the aesthetics. This is diving into wellness, into health, into preventing falls on patients. Just having a stronger core has so many benefits. And actually, it has shown on some studies that if you do 6 sessions, it actually decreases the visceral fat. So while we cannot make any claims about this, this actually may correlate with metabolic syndrome and decreasing diabetes and hypertension just by the fact that we're also helping with that visceral fat. This is a male patient who obviously wasn't too far from his goals, and this is where this becomes important. Arguably, this patient could come back and say, I didn't really see a change. Fortunately, he did, and we have objective data to show that he actually had at least close to 8 centimeters of decrease in his abdominal circumference. And I can tell you just from my personal experience, I've always thankfully had good genes, and I've always been sort of on the thin side. But I did it. I literally have done every treatment that we offer in the practice. I have gone through myself. I can speak from experience. And I did it, and when I did my 4 sessions, I was like, I don't know that I see a change. And I went through this, and mine changed like a good 3 or 4 centimeters. So first, I could have been, if I had been a paying customer or client who's saying there's really been no change. You put my BNAs together, and you really see very little change. But when you do the objective measurements, there's definitely been an improvement that's undeniable. And obviously, I'm excited to continue doing it. If it's a paying customer or client, they're going to be excited to continue. Okay? This device is actually available here for you guys to try. So it's actually on the exhibition hall. BTL is there, so go ahead and try it. Literally, all you have to do is just raise your shirt. They're going to put the device here. You guys need to experience this. This is really incredible, and it's available worldwide. So definitely something that has made a big difference in my practice.